right. Hi, everybody. Hello, welcome. Good morning, good afternoon, good evening, wherever you're joining us today. My name is Haley Campbell, and I am a project director at the Global Consortium on Climate and Health Education based at Columbia University. And it's my pleasure today to welcome you to the September Member Learning Collaborative webinar. And today's focus will be specifically on climate change curriculum and student perspectives. So if this is your first time attending a GCCHE Learning Collaborative webinar, the aim of this series is to have conversations to provide opportunities for our members to share and learn about strategies, challenges, and success stories for integrating climate and planetary health education principles into their health professional curricula. So just before we get started here, I wanted to let everyone know that there is live interpretation today available in Spanish. So if you want to select your preferred language, there is a globe icon in the Zoom toolbar, and you can select either to listen in English today or in Spanish. So I just wanted to quickly review some housekeeping, go over the agenda. Like I said, today's webinar will have a specific focus on student and trainee perspectives on education and curriculum within the climate and health, planetary health lens. And today we'll begin our presentations with the Cleveland Clinic Lerner College of Medicine and Case Western Reserve University School of Medicine, followed by the Planetary Health Report Card. And to close the session today, we'll have question and answer portion. So if you have any questions throughout either of the presentations for either of the institutions today, please just write them in the chat, write them in the Q&A, and I will collect them as we go through the presentations. So we have some very exciting presenters who will be sharing their experience with climate change and health curricula today at their medical institutions and programs. So first we'll hear from the Cleveland Clinic Lerner College of Medicine, and we have Malia Vlader joining us today. Malia is currently a second-year medical student at the Cleveland Clinic and is an MS candidate for nutrition and is a food as medicine project co-lead. Joined by Malia, we have Arjun, who is a second-year medical student at Cleveland Clinic and is a member of the Climate Change and Health Curriculum Committee as well. Joined with them as well is Nupur, who is a second-year medical student as well and is a member of the LGBTQ Curriculum Action Group, Case Med Pride Board at Case Western University School of Medicine. And to finish us off today, we're joined by Arya Pontula, who has been involved with the Planetary Health Report Card since 2020 and is a co-lead at University of Manchester on the leadership team and regional lead for new countries. And this year she is serving as the co-director of the Planetary Health Report Card. So thank you all so incredibly much for being here today. Sharing your perspectives with our audience is incredibly valuable. And I will pass the floor off to the Cleveland Clinic team.
Thank you, Haley. Okay, let me just share my screen. Okay.
Great.
All right.
Looks
Thank
good.
you. Thank you. Thank you, everyone, so much for being here. We're really excited to talk to you a little bit about our climate curriculum at the Cleveland Clinic Lerner College of Medicine. And as Haley said, my name's Malia, and I'm here with my colleagues Nupur and Arjun as well. And then we're going to be talking about the climate curriculum model that was actually created by James Sullivan, Catherine Lowe, and Dr. Gordon Colbert, Salas, Bernstein, John Utek, Dr. Nadowitz, Maida, and Isaacson. So we just wanted to acknowledge them and that this is the model they came up with for integration into our Cleveland Clinic curriculum. So with that, we'll just get started. So a little overview of our presentation. We will first talk about some of the current challenges to climate change and health curriculum integration. Then we'll go into our integrative method. And then we'll talk about how we've longitudinally integrated the climate change and health objectives into our curriculum in both preclinical and clinical phases. And then we'll talk a little bit about our student perspectives and some key takeaways. And with that, I will hand it over to my colleague, Nupur.
Hi, can everyone hear me? Sorry, my unmute button wasn't working for a second. Okay, sweet. Hi, so I'm Nupur. Thanks, Malia, for and also Haley for introducing us. So just starting off, we want to acknowledge that there are some challenges that are currently faced in terms of integrating climate change and health into medical school curriculums. And so in a survey of health professional deans, 71% of deans actually reported that they faced challenges in integrating climate change and health into their curriculums. And some of the reasons that they faced these challenges was due to limited time in the curriculum, as well as limited faculty time and competing priorities in medical education. So kind of as an overview of some of like the baseline requirements for medical education, we know that when a student goes through medical school, they have to learn the traditional biomedical content. That's what we're coming in for. And so we have to have an understanding of human physiology as well as human disease. But a lot of times what this leaves us with is a foundational understanding of health and disease that's kind of in a vacuum in isolation. But we know that in terms of trying to integrate these other things into the curriculum, we have to be mindful of these time constraints that are placed on both faculty as well as the required curriculum of our schools. And so with that, we can move on to the next slide. And so kind of the importance of integrating things like climate change into our curriculums is because health and disease, as we know, aren't exclusively explained by biomedical knowledge. And so as we know, there are a lot of determinants of health. And so we know that social determinants of health are made up of many like different things such as community and social impacts, our neighborhoods and our physical environments, our healthcare systems, our economic stability, education and health literacy, as well as food and nutrition. So all of these things are constantly impacting a patient's health status, as well as the efficacy of care that they're able to receive. And so we also know that climate change impacts many of these individual determinants of health. So for example, we know that climate change has direct impacts on your physical environment. It also places undue burdens on the healthcare system. It has implications for economic stability, as well as food and nutrition, and it impacts communities as a whole, in addition to impacting communities that are already disproportionately impacted by different health conditions. And so we know that climate change is kind of both threatening our ability to prevent disease as well as disrupting the ability of us to provide healthcare. And so we know that when we're looking at education, we want to actually include these impacts so that we're not educating students in isolation about the biological determinants of disease, but we're also accounting for these other things that are significant for patient health. So we can move on to the next slide. And so our school has taken an integrative approach in order to kind of tackle some of those things we talked about earlier in terms of time constraints, as well as needing to hit everything in the curriculum. And so what we do is we integrate different stakeholders into this process in order to minimally disrupt our curriculum. And so what we have is a team of students, deans, as well as faculty. And what they do is they actually collaborate, and we'll go through like the process of where everyone actually puts in input for this curriculum integration. But this enables us to kind of overcome the lack of faculty time, as well as lack of engagement on the student side, as well as from the course director side. And it allows us to kind of get some support from different people involved in the curriculum. And so we kind of get a more seamless integration of these topics. So we can move on. And so what the integrative method does is it starts by identifying the overall goals that we have as a school. And then from that, we go into specific learning objectives. And so this is talking about how we're actually integrating the climate change and health concepts into the curriculum. And then we're able to align the outcomes of these learning objectives with the school's framework of their overarching educational objectives. And then we can propose small modifications to the curriculum based off of what the current curriculum looks like. So again, we're trying not to disrupt what we already have too much. And then we're able to review and implement this. And this is where having the multiple stakeholders really comes into play. So we can move on to the next slide. And so we're kind of going to walk through an example of what this looks like at our school. And so at our school, we have 9 different competencies that students are required to meet. And so everything that we do in terms of integrating things into the curriculum is done kind of in the lens of these 9 different curricular competencies. And so some of the ones that we've been able to address with the climate change and health curriculum are research and scholarship, knowledge for practice, patient care, and systems-based practice, which is more like healthcare systems and delivery of care. And so when we look at these like 4 different competencies, we can look at how we can apply the information that we want students to take away about climate change and health into each of these so that they're still able to kind of align with what the school's vision is. So you can move on to the next slide. And so kind of the first step in doing this is determining our overarching curricular goals. And so again, we do this through competencies. And so for example, here, our goal was to encourage students to understand the impact of climate change on different communities. So you can hit next. And so the competencies, which I reviewed earlier, that we can kind of address this through are teamwork and interprofessional collaboration. So our school wants us to learn how to work in teams. So we can have students work in teams in different like case-based learning in order to kind of reach this outcome of understanding climate change's impact on communities. We also, our school wants us to understand systems-based practices and health systems so we can encourage students to appreciate the burden of climate change on health systems. And then knowledge for practice, we can encourage them to understand more specific things such as how does air pollution impact asthma, like for example, so something more granular. And then for research and scholarship, we can encourage them to review papers that are related to climate change and health. And then I'll hand it over to Arjun now.
Yeah, thank you, Nupur. So now moving on to determining the learning objectives, this is the next step of the integrative method. And you can kind of see we're still starting at that overarching goal of understanding the impact of climate change on communities. But now when we design learning objectives, they are meant to address specific aspects of that goal within the competency framework. So Malia, if you could hit next. Here's an example of how we're honing in on that overarching goal, maybe in the context of heat risk and health events associated with that. So you can see 2 learning objectives that have been implemented into our curriculum are identifying causes of urban heat islands and also explaining how physical characteristics of a neighborhood increase community health risks during heat events. So this is that next step. And then our third step is aligning the outcomes within the school's educational framework. So now that we have an idea of what our overarching goal is, we've specified it down a little bit through our learning objectives. Now we want to see how we can possibly fit these changes into our educational framework. So the big thing here that we're focusing on is that we have a pre-clerkship and a clerkship aspect of our curriculum. So in the first 2 years, students are learning through team-based case learning. So in this example, maybe they, in a patient case that's discussing asthma, also start to think about how heat-related events could affect inhaler validity. And then we also have team-based didactic sessions in the last 2 years, the clerkship aspect of the medical school curriculum. So integrating our learning objectives into both parts of our curriculum. Next slide, Malia. Thank you. And finally, we have proposed modifications. So now we actually establish modifications to existing activities to meet the CCH goal. So again, now we're thinking more specifically into 2 different buckets of our medical school curriculum. The first 2 years, the pre-clerkship, and the last 2 years, the clerkship model. So if Malia, you could hit next, we can see some examples. So like I was saying, adding references to urban heat islands and asthma exacerbation in an existing asthma case for that pre-clerkship model, and also making sure that students are able to understand mechanisms that could be causing increased heat throughout the planet. And then in a clerkship aspect of our curriculum, we want to make sure that students are having a discussion of climate vulnerabilities in families in Cleveland, which is where our school is based, but also being able to discuss barriers to care, comorbidities, and susceptibility to heat. So this is around the end of our integrative method, where we're actually establishing concrete changes. And then after we've decided on some concrete changes, our very, very last step is reviewing and implementing. So after these changes have been proposed, like Nupur was talking about, this large group of stakeholders, the students, deans, and faculty, come together to review proposed changes and decide the exact way that they'd be implemented. So Malia, if you could hit next. And so this happens through many different ways. First of all, CCH curricular development working group reviews occur. So this is where students, deans, and course directors for specific organ blocks work together to determine what content would fit in the current curriculum while still meeting all the other competencies and requirements of the curriculum. The course and clerkship directors are obviously involved in that. And then we also have pre-clerkship and clerkship development committees review to make sure that these climate change and health concepts are being integrated in both big buckets of our medical school curriculum. And so this slide is just kind of summarizing, the past few slides that we've been talking about with our example, and just showing how it's implemented throughout our curriculum. So starting off again with that goal, understanding the impact of climate change on communities, we honed in on that goal a little bit more to form this learning objective of identifying the causes of urban heat islands. Within the pre-clerkship problem-based learning curriculum, we made some adjustments to see where we could fit this content. And then finally adding references to urban heat islands and asthma exacerbation in an existing asthma case after review of the modifications by multiple stakeholders. Next slide. Thank you. And so this is a figure from a paper that our group had published in 2022, and that you can see other different routes where we've used the integrative method to establish climate change and health concepts into our curriculum. So this has ranged not only from the team-based problem learning that I talked about earlier in our example, but also through basic science journal clubs. Our curriculum is very research-based and involves a lot of focus on research. So finding ways to help students understand how climate change plays a role in potential research paths that they may take in the future is another big aspect of the integrated method at our school. And then finally, the medical humanities are also a place where we try to ensure that the integrated method is incorporating climate change concepts into, so that students are really able to fully understand how climate change and health are interconnected. And I'll hand it off to Malia now for the rest of the presentation.
Okay, thank you, Arjun. Yeah, so we've kind of walked you through the specifics of how we integrate climate change and health into our curriculum using our very specific integrative process. So now we want to talk a little bit about how we integrate it longitudinally throughout different phases of our curriculum. So we've integrated it into pre-clerkship, clerkship phases, as well as extracurricular activities and post-clerkship phases. So some of the examples of how we've integrated it into our pre-clerkship phase includes into our summer research journal club, where we have a paper that discusses the impacts of climate change, and then also into our problem-based learning sessions, which are our weekly case-based sessions that our students go over. And then also into our clinical and communication skills sessions, as well as our medical humanities courses. And then in the clerkship phase, we've integrated it into didactic sessions, such as the psychiatry didactic that we'll talk a little bit more about. And then in the extracurricular phases, activities and post-clerkship phases, we've integrated it into our climate and health pathway, which is an option for students to do extracurricularly, where they can be involved in not only a speaker series where they learn about climate change and health, but they also have opportunities for research, advocacy, and also opportunities to integrate climate change and health into their interactions with patients. And then we also had one of our own, James Sullivan, actually participate in the GCCHE Medical Student Fellowship. And then we also have opportunities for research, such as James and Kate's, actually their paper that showed this model. And then we also had a Climate and Health Education Summit and collaborative through Case Western and Cleveland Clinic Learner College of Medicine. So just to give you some examples, what we're doing in the preclinical curriculum currently is we've modified PBL cases to include environmental triggers for diseases such as asthma. And then we've discussed how historically redline neighborhoods are more at risk for the impacts of climate change. And we'll give you a specific example of this as well. And then we are also taught about counseling patients on new disease vectors that they may encounter due to expanding territory of ticks that may carry Lyme. And then some of our planned future integrations include further integration into our problem-based, case-based learning sessions, and further integration into our humanities courses and our ethics courses on resource management during supply chain disruptions due to climate change. And then for our an example of how we allow students to self-assess their how they've absorbed the problem-based learning, case-based learning, climate change and health curriculum is this question. So we have self-assessment questions, and one of them was involving the climate change and health learning objective for that week. So the question for the asthma case that we've been talking about read like this, and the main ideas were that exposure to heat is dangerous for a number of health conditions such as asthma, CHF, and kidney disease. Red line neighborhoods are more vulnerable to climate-related risks. And the question is, which of the following factors is the primary underlying cause of the heat-related disparity between redlined and non-redlined areas? And then the answer was that more brick buildings, they have more impermeable surfaces, less foliage, is driven by historical housing practices that deterred green space in single family homes. And this creates a more powerful urban heat island effect in redline neighborhoods than non-redline neighborhoods. And so actually this was a great success. We had last year, 100% of the students got this question right. So we thought that really demonstrated that they were able to engage with the curriculum and they learned from it. And then for our clinical curriculum, the way we're currently integrating climate change and health into the clinical blocks is through didactic sessions. So for example, we have a psych didactic lecture on the intersection of climate change and psychiatry. And it includes the effect of climate change on mental health, such as worsening anxiety, and also how to manage these complex patients. And then some planned future integrations include integration into further didactic sessions across the clerkship blocks and into their clerkship rotations as well. And so now for some student perspectives, we'll just each talk a little bit about our perspective. I'll go first. So when I started school, I didn't know that much about the intersection of climate change and health. And through the incorporation of that climate change and health curriculum into the PBL case, when I encountered the asthma case, it really got me interested and was engaging for me. And I reached out and found this group. And so I think that this demonstrates the ability of the curriculum to not only teach students the concepts, but also engage more people and hopefully lead to more future physicians who are aware of these ideas and able to integrate it into their practice. And then with that, I'll pass it off to Nupur.
Thanks, Malia. So I wanted to talk about another one of our experiences with the integration, which I think really demonstrates how it can be really helpful when you have different stakeholders engaged. And so in our curriculum in our first year, we have a geriatric session, which is led by some of the geriatric physicians who teach us a little bit about some of the unique health risks that the geriatric population faces. And so actually, the course director for this incorporated how elderly patients are at increased risk for experiencing some of the impacts of climate change and health. And he gave us some data from how elderly patients were impacted by heat waves disproportionately. And I thought that that was like a really nice integration of the material, which helped us appreciate not just from like we can like learn about diseases effect, but also from the perspective of someone who's trying to tell us about their field that like, hey, this is something that matters and like you should learn more about it. And so I think that when you have professors who get really engaged with the content and when you include them in the conversation about integrating things into the curriculum, their passion for like the subject also shows, and they're able to teach students about it and kind of keep them engaged as well. So I'll hand it off to Arjun.
Yeah, and the last aspect that I wanted to talk about was the incorporation of CCH into our clinical research curriculum. As I mentioned, our school does have a pretty large emphasis on research and training medical students to becoming physician investigators. So throughout our clinical research curriculum, most of which is through the summer between our first and second years, we go through and we learn a lot about how clinical research studies are structured, different concepts regarding epidemiology and biostatistics. And one of the papers that we discussed was looking at, it was a cross-sectional study looking at environmental temperature and growth faltering in African children. So, although the emphasis on the paper was learning about the study design and methodology, it still was very helpful to integrate this into this part of the curriculum for students to kind of see that and research into climate change concepts and how they relate with health could be a future career that we could look into as physician investigators.
Thank you, Arjun. And so for some of our key takeaways, we found that an integrative model is key to minimally displacing the current biomedical curriculum and to overcoming the challenges such as lack of time in the curriculum. And then a multi-stakeholder approach engages multiple parties to overcome lack of faculty time. And integration both horizontally and vertically into the curriculum has been critical to including the climate change and health learning goals into our curriculum. All right, and then here are our acknowledgements. Again, we want to thank James, Catherine, Dr. Gordon Colbert, Salas Bernstein, John, Dr. Nadowitz, Maida, and Isaacson for their wonderful integrative model. And then this is the paper that they wrote on this model if anyone would like to learn more. Thank you.
Great. Thank you so much for sharing your integrative model. And thank you for starting your presentation with the kind of perceived barriers to integrating principles on climate and health and the entryway points here. It's not about completely changing the curriculum. It's about, like you said, the kind of horizontal integration. So thanks again. And we'll move right on along to the Planetary Health Report Card presentation, and we will close the session with questions, which there have been many in the chat so far. So thanks again. And Aria, I'll give you the floor.
Sounds good. Let me share my screen. All right. Thank you so much, Haley, for organizing all of this and for inviting me to come and speak about the Planetary Health Report Card. And thank you so much to all of you for being here. GCCHE has been a big partner for us at the Planetary Health Report Card pretty much since the report card started. So it's actually a nice full circle moment to come back and speak about the work that we've done over the last 4 or 5 years. and speak to you all a little bit about what we've seen in terms of student perspectives on incorporating climate into the curriculum. For me, as a medical student, obviously thinking a lot about what we learn, a lot about disease pathophysiology, and looking at the things that drive disease, it becomes clear that it is not often or occasionally overlooked how much climate has to do with driving disease processes forward. And another thing at the Planetary Health Report Card that we think about a lot is how the practice of medicine, so the act of delivering clinical care itself, impacts the environment. And so those are things that I think about sort of as I go, on my rotations, and as a future surgeon, think about the things that we do that impact the environment. And just before I begin, I want to give a special thanks to Emily Cody and James Lee, who are both co-directors of the Planetary Health Report Card with me, and without whom none of this work would be possible. So as I mentioned, and as we all know, our changing climate impacts human health. And what I really wanted to highlight here is that while we know this, a lot of research that has been done over the last few years as we gain traction in the fields of machine learning and artificial intelligence, we're better able to predict how the two things interact with each other. So we're better able to make predictive models that would tell us how many people are actually impacted by climate change on a day-to-day basis per year, how many people are dying of things like outdoor air pollution, fossil fuel use. And it would also help us, or has helped us, really kind of predict if we make a certain change, how will that actually have a downstream effect? And I really like this diagram, which probably a lot of you have seen already, but I think it very concisely sums up the impacts of climate change on human health in a way that makes it very easy to see the direct relationships between different things. And then the other piece that I spoke about was this idea of delivering clinical care and that impacting our climate. So the American Medical Association recommends that physicians should make sure that they're involved in activities that contribute to bettering public health. And I think it's important to recognize that a lot of what we do in delivering health, so our use of PPE, our use of anesthetic in the OR, our use of even prescribing certain inhalers, so meter dose inhalers, end up causing harm to the environment in the way that we prescribe them. So it's said that about 9% of all respiratory diseases are due to carbon dioxide emissions from the healthcare industry in the US. And I think this really puts into perspective the fine line that we have to tread as future health professionals of first recognizing the impact that climate has on our patients, as well as how our ability to care for them should be informed by consideration of the climate. And then in the NHS, so England's National Health System, this is sort of a breakdown of how different pieces of delivering healthcare end up impacting carbon dioxide emissions. Okay, so what I really hope to talk about today is planetary health, just a brief overview, as well as the PHRC, so what our goals and processes are and have been. And then I want to talk about putting sort of what the Cleveland Clinic and Case Western team were talking about in sort of a broader context, a broader lens to look at, how can you use what the PHRC has in terms of evaluating medical school and health professional school health, and then use those resources to assess and find and fill gaps. Okay, planetary health is a really good term. It's one that I wasn't very familiar with before I started with the PHRC, but it's one that describes this interaction between human health and the health of natural systems. And to me, it speaks to a couple of different ideas that I think are really important in making lasting change. The first is that it's action-oriented, so I think it can be easy to sort of fall into the advocacy space, which is obviously very important, but without moving towards true action and long-lasting action. Planetary health is also very transdisciplinary. So this is something that we have tried to include in the Planetary Health Report Card over the years in terms of incorporating different disciplines. And of course, collaborative, which goes along with the transdisciplinary aspect of it. But the idea of the Planetary Health Report Card is really to increase both awareness and accountability in health professional schools related to planetary health. And that is our goal in terms of our yearly cycle. So the Planetary Health Report Card, for those of you who haven't heard of it before, is essentially a needs-based assessment. So we have a true report card, and that report card has 5 metrics or 5 categories, which I'll get into later. But each of those categories allows a health professional school and a team of students within that school to assess how their school is addressing planetary health issues. And so over time, our impact and reach has actually grown quite a bit, and it's been really inspiring to see that growth, which has been mainly driven by students. So when we started out, we were just in 2 countries, so the US and Canada, and you can see that's climbed really steadily over time. So last year, in the most recent iteration of the Planetary Health Report Card, we had 18 countries total. We've also grown in terms of medical schools, so the Planetary Health Report Card started in medical schools, and we have just, I think, about 156 medical schools now. And what I and the rest of our leadership team is really proud of is the growth in disciplines as well. So for the first 3 years of the Planetary Health Report Card, we were in only medical schools. But over the last couple of years, we've tried to expand into related health disciplines. So disciplines like veterinary science, pharmacy, occupational therapy, public health, all health professionals that we work together closely with, even as students, who have reached out to us and displayed interest in getting involved in this. And it's something that we are hoping to continue during this year as well. Okay, so I mentioned earlier that the Planetary Health Report Card is based out of these 5 big categories of metrics. And the one that I want to focus on for most of this presentation is the first one, which is the Planetary Health Curriculum. But I think it's important that we also recognize the other aspects of planetary health and planetary health commitment on a campus. And these, as we identified in the Planetary Health Report Card, are research, advocacy and community outreach, as well as support for student-led planetary health initiatives and campus sustainability. So these pieces all tie together, I feel, in terms of supporting and upholding planetary health curriculum. But it's important to recognize that there are multiple and varied opportunities for incorporating planetary health, and all of them sort of work together in terms of making the impact that you'd like to see. So I've put here a couple of examples of metrics that we have for each of these, and I handpicked a couple that sort of make sense in terms of representing what the overall metrics look like. So the first one under the curriculum is just like looking at, you know, does your medical school offer elective courses to engage students in terms of looking at planetary health? And in the same way, the Planetary Health Report Card has a number of different questions about lectures, about student-selected components, about the ability to pursue research projects through the curriculum. That would engage students with planetary health. And as you can see, all of the metrics or questions are structured in this way where students go through and they evaluate what the curriculum looks like, and then they assign themselves a grade. So it's all self-reported in terms of what they think their school's commitment to planetary health looks like. We do ask them to provide justification. So often students will link to certain part of the curriculum or link to a certain professor whose lecture has delivered something about planetary health. And that kind of plays into the idea of the PHRC sharing these best practices across the world so that you know, other schools and other health professional schools can learn from each other. Okay, so the first part, I talked about the idea of assessing needs, and the Planetary Health Report Card is a good way of doing that. There are, of course, other ways of doing that as well, and it's also a good way of tracking it. What we found through the Planetary Health Report Card is the importance of having a team and a community in terms of continuing this work. So the Planetary Health Report Card recommends that students get involved in teams that comprise of students of all years, because often we find that the curriculum changes as students go through the years, and as the medical school or health professional school responds to feedback from students, the curriculum itself changes. So it can be useful to have diversity and perspective from students in different years. We've also found that the teams that are really successful have kind of long-standing guidance from faculty members. These are faculty members who often have some sort of interest in planetary health and are willing to guide students through the process of evaluating and updating the curriculum. A lot of our students also get involved with local organizations who have established resources. So a good example of this is Medical Students for Sustainable Future. This is really well established in the United States. There are similar organizations in other countries that do similar things. And it can be helpful for students who are trying to make this change happen in their universities to partner with these sorts of local organizations who have an idea of how to affect that change. And then equally, there are international organizations that have done similar things and already have a lot of established reach and resources as well that are useful to implement. Okay. And then the third step, and this kind of speaks to what I was saying before, is that there's this idea of intra and cross-institutional collaboration that is really helpful in making sure that the change that you implement is lasting, and also that you're not repeating work that's already been done. So there are a lot of different resources out there in terms of including modules for planetary health into your own medical school or health professional school curriculum. And a lot of what we do at the Planetary Health Report Card is directing our students and our teams to these resources that are out there, and then connecting teams with each other so that they can learn from each other. So I've put a couple examples here of intra-institutional collaboration, which is something that we've been trying to work on encouraging through the Planetary Health Report Card, especially as we add on more disciplines. So we have a lot of universities that have, for example, a medical school, they'll have a nursing school, and say they'll have like a pharmacy school as well. And if all of those health professional disciplines are interested in getting involved in the Planetary Health Report Card, or even just interested in planetary health change, we encourage them to speak to each other, because a lot of this, a lot of the idea of encouraging research, encouraging campus sustainability is something that they can work together on, and they often have really important different perspectives that they can contribute to each other. And so these are examples of some of the ones that our students at the Planetary Health Report Card have suggested. So in Galway in Ireland, so they have this One Health Center that brings together different disciplines. And then Uktal University is in India, and they do a similar thing here. This is Newcastle University's One Health Center, and Karolinska Institute also has an Institute for the Environment. And we found that there are a lot of different perspectives that different departments can bring in, ways that they tackle the idea of including planetary health in their curriculums, even if it's not a health profession. Okay, the fourth part of this, which I think that the Case Western team really did a good job of talking about, is developing a curriculum plan that is clear and well set out. So through the Planetary Health Report Card or any other way, you would have already assessed what's been done. And I think that especially when you're trying to affect change for the first time and trying to start that conversation with faculty and leadership at a health professional school, it's important to make sure that the first step that you suggest isn't something that is, completely out of the blue. It's something that seems like a reasonable, feasible, easy first step. And this is something that we recommend that a lot of our students do when they have this first conversation. And often the PHRC can be that first conversation. So when students go through and fill out the PHRC for the first time, we have a lot of stories of students who connected with their faculty because their faculty members realized how poorly their schools were performing in terms of these things, which can often be a really good conversation starter for affecting change in the curriculum. And it means that you can connect with faculty and leadership who are often at a health professional school for a little bit longer than the students are. And it can give you a good idea of, how do you get perspectives from students in all years, as well as from faculty who have been involved in creating and changing the curriculum. What I really want to talk about here is the idea of both longitudinal and latitudinal integration. So longitudinal integration, we're looking at making sure that the curriculum is hit in all parts of, for example, the medical curriculum. Most medical schools have a preclinical portion and a clinical portion, and making sure that when you integrate climate or planetary health in the curriculum, it's not just in one part, in one lecture, that it's something that students can engage with throughout their years in the program. The other part of this is latitudinal integration. I think medical schools do a really good job of making sure that their students are learning in different ways. So even in your preclinical years, if you have student-selected components, student-selected research projects, if there are options there for students to pursue things that have to do with planetary health or the impact of the environment on health, then it's there and it's something that students have the option to engage with. And even if they don't, it's something that they can see as an important part of their education. And then I think another really important thing to consider here is that when you're developing this curriculum plan, you want to consider that there are some factors that affect student engagement. So around the time of exams, around the time of really busy rotations, around the time of applications, students may not be as willing to engage with, things that have to do with planetary health, if they feel like it's not like the next thing that they need to get done. And this is something we've worked a lot with our students at the PHRCs, trying to develop curriculum that impacts students when they're ready or when they're best able to engage with that information. And I think that is an individualized school sort of thing. It depends on how the school sets up their curriculum, how the school year runs. So we've learned internationally that there are differences in the way that the school year is structured in different places, and that requires sort of an open mind in terms of looking at developing this plan. And then the last piece I wanted to talk about was infrastructure. So I think students are really important in driving forward this change, but unfortunately, because we're students, we don't stay in a program for very long, maybe 5-6 years at the maximum. And so I think it's really important to build changes that are lasting. So when you integrate something into the curriculum, if it's something that you can in some way ensure it carries on into the future. So if it's a lecture that stays on the curriculum for years going forward, if it's options that are run by a specific faculty mentor, and that mentor will be there to make sure that those research options remain available. And then the other piece of this is to create a team and a sort of sustainability in terms of students who are ready to keep carrying the baton and make sure that they will be able to keep evaluating the curriculum and evaluating commitment to delivering planetary health teaching. And then I think the third part of this is really important in terms of documentation. So it can be very useful, and we found a lot with our teams is it can be really useful to have really good documentation of plans as well as goals. And the third part of this is timeline. So looking at what has already been done in our school, what are our plans going forward, and then how can we change these based on the way that things are progressing in terms of planetary health, as planetary health changes as a field, as well as, if there are ways that they can do things that are better. And I think the documentation often also really helps in making sure that work isn't repeated. Okay, so just in summary, these are the 6 kind of pieces that I talked about. I split the institutional and cross-institutional into 2 pieces. But the idea is that it's a circular process, it's a cyclical process, and it's something that requires continual reassessment. And at the PHRC, we like to view the report card as a way of assessing that every year. And that can be a good way to begin by starting to identify needs. We've then found that forming a team and getting involved in the larger planetary health community is a really important part of affecting change. And a lot of that is supported by collaboration within one institution as well as across institutions. When you're ready to start affecting that change, an important part of making sure that the change is something that is easily implementable is developing a curriculum plan that is clear, that is concise and well documented. And then the final piece of this is really working towards developing comprehensive infrastructure and ensuring that the goals that you have for your team and for implementing certain pieces of the curriculum are things that won't be lost when students graduate. Okay, and then finally, I just want to acknowledge the different organizations that have supported the PHRC, one of which is the GCCHE. The Josiah Macy Junior Foundation has also provided us with some financial support, as well as the other organizations you see here. I wanted to give a special thank you to Taylor Dietrich and Isabel Waters, who were the co-directors of the PHRC last year, and again, were really important in creating and delivering the PHRC over the last couple of years. Thank you.
Amazing. Thanks so much, Aria, for sharing the really impactful work of the Planetary Health Report Card. Now we're going to move in these last 9 or so minutes here into question and answer portion today. Just add you all. So yeah, thank you again to both institutions for sharing your really incredible programs. We've got lots of questions in the chat, but I think I want to start by just going back to that statistic that the Case Western team shared, that 71% of deans, have said that they experience challenges in integrating climate and health. And there's a lack of faculty expertise on the subject to teach students. And it's my thought, current students eventually one day will become these educators, and this gap in knowledge will absolutely not be filled unless medical training includes these principles. So thank you so much for highlighting that at the very beginning. And it's just a testament to all of your presentations today. So thank you for that. And going into kind of my first question here that Juan Julio has shared in the chat, and I translated it, so it might be a bit strange, but I think I understand what he's getting at. He's asking, does strengthening of this curriculum within aspects of climate change also implies a rapprochement or like a harmonization of the university with specific, I guess, specialized aspects in climate change? But I think what he's getting at is kind of the role in administrative support as a barrier as well to this integration. And maybe if the Case Western team could just speak a bit more about what the response was like from the medical school dean when you embarked on this integration project, because I think that's a huge barrier for a lot of medical institutions. Yeah.
I can kind of jump in here, and then Malia and Arjun as well. But I think that our school is kind of in a unique position in that, at least when we joined the group, which was all at the same time last year, our big dean is like in our climate change and health curriculum group, and he comes to like all the meetings, and he's very supportive of like the integration. And like one of our deans of education is also in the group. And so I think like we have probably like a lot more support than like Aria. I don't know, like, because you've talked to people at different institutions who probably like don't have that, but I think that like at our school we're very fortunate in that regard.
Yeah, for sure.
Oh,
sorry.
Go ahead,
Maria.
Aria.
No, you go ahead.
Okay, I just want to add real quick that, yeah, because of our small class size too, we only have 32 people a class and 5 years. So we have a very small group of people, and our school is very feedback oriented. So that also helps because the school is just very receptive to our feedback and our ideas. So my understanding is that the rapprochement and harmonization was very seamless, and that the climate change and health group was able to integrate things into the curriculum fairly quickly. My understanding is the group started during COVID, and then it had climate change and health integration already within a couple years after that. So.
Great, thank you. I just see a comment in the chat that says like teamwork. I think although you do have a bit more of like a lean, agile team, I think teamwork is at the core of it. At least from the presentation that you just showed me for Case Western. Moving on, Aria, I have a question about the kind of onboarding structure of the Planetary Health Report Card. For say there's a medical student that wants to set up a chapter. How do they go about this process? And also, do they all have to have a faculty mentor, correct? Does this mentor have to have experience with climate and planetary health, or is it just kind of the interest is enough?
Yeah, no, thank you for that question. What we try to do is we try to support students who are interested regardless of the support of their institution. So because, you know, we really have
Oh, have we lost her? Or is it me?
Can you hear me?
Oh, sorry, Aria, you're freezing just a bit, just as you started speaking. Sorry if you wouldn't mind repeating.
Yeah, no, of course. I just wanted to say thank you for asking that question because I think we definitely have a range of institutions who are involved in the Planetary Health Report Card, where we have institutions where the leadership are really supportive. And then on the other
Yep.
side, we have some institutions where it is a little bit more of an uphill battle in terms of making this a priority. For students who are interested, honestly, the best way is to reach out to us. I can put the PH report card email in the chat. But what we try to do is we try to support students who are interested in evaluating their schools regardless of the support of their university. So if it's difficult for you to find a faculty mentor, or if it's difficult to get your administration involved, we have a lot of people on the team who are experienced with working in similar situations. And we'd be able to guide you kind of through the process of doing it. The good part of the Planetary Health Report Card is that it's completely student driven. So if you don't have the supportive faculty, you are still able to evaluate your curriculum because you are the ones who are undertaking that curriculum. And so it's possible for students to form their own team. If a student is interested on their own, we definitely recommend that they form a student team. And then what we ask students to do is to fill out the report card to the best of their ability, and then to inform their leadership before they publish it and to say, like, look, we've gone through, we've evaluated the curriculum, here's what we're planning on publishing, just so that you know where things stand. And often that can be a really good conversation starter as well.
Great, thank you so much. We only have 2 minutes here, but I want to give the opportunity to each institution to answer kind of one final question for the both of you. It's kind of two-pronged. But I'm a public health professional, but I want to know, kind of asking you all as future clinicians, like how did you become interested and involved with climate as a topic as it pertains to health and also in the curricular space? And adding on to that, what kind of recommendations would you give to kind of any practicing or trainee that's interested in maybe participating in the integrative model? Like, what recommendations would you give them? And also planetary health report card implementation as well. So sorry, it was a bit of a long question, but maybe I'll give Case Western the opportunity to respond there.
I can quickly go on behalf of us. At least for me, I think it took, maybe this isn't the best way to have like really start to think about climate change and health, but at least in Ohio, the summer before we started actually is when we had a lot of the effects of Canadian wildfires, a lot of smoke coming into the area. So our air quality indexes were horrible. There's like news throughout the region of like a lot of like health effects. So like at least for me, it took like a lot more direct examples to start to see like how important this was to like how climate change was affecting health. And like Nupur kind of shared during our presentation, just starting to realize that health is not just, I don't know, whatever we learn in our textbooks, like these foundational aspects of it, but that's very integrated with other aspects of what's going on around the planet. And at least I guess like recommendations for other students and people interested in getting involved, I would say definitely look for collaborators and others in the space to share ideas with and learn from. At least us, like Nupur and Malia said, we're very lucky. We have a very supportive community at Cleveland. But you know, if you don't have that, there's like great groups like the GCCHE. So yeah, definitely look out for that.
Great. Thank you, Arjun. And Arya, for a closing word here.
Yeah, I think I would say for students who are looking to get involved, first, not to give up, because I think it can be difficult if there are not people around you who are interested in the same things, because they are there. It's just a matter of connecting with them. And I think, like Arjun said, organizations like the GCCHE are a really good example of people around the world who are working on similar things that you would want to work on. And honestly, also just not to be afraid of reaching out if it means you're emailing somebody that you've never spoken to before, or never even, considered emailing. If you send the email, there's always the possibility they'll respond, and always the possibility that you could work together on doing something that's truly impactful.
Great. Well, thank you to all of you for sharing your perspectives today. I think the success of your programs and the growth of the Planetary Health Report Card, really, it was exponential. It just kind of shows the appetite for this kind of information from medical students. And your voices are very, very powerful in this space, not only as people that are kind of experiencing this climate reality, but, your patients will be experiencing the impacts of climate change, in the imminent future. And so thank you for not giving up and for sharing your programs with us today. And I really hope to stay in touch and hear more about how things develop going forward. So thank you all again. And thank you to all of the participants for joining us today. I just want to end quickly by letting you know the next session of the Member Learning Collaborative is on November 21st, and will specifically focus on veterinary education and climate change. So we hope that you will join us, and thank you all again, and have a great rest of your day or evening. Bye.
Thank you.